When the Badgers face Ohio State tomorrow night in the biggest game of the season, the woman who helped propel the football program to greatness will be in the stands.
Former UW Chancellor and former Health and Human Services Secretary Donna Shalala is in town this weekend.
She's here for an event at the UW School of Nursing. We met up with her at the Memorial Union and talked about some of her favorite Madison memories.
Well, welcome back to Madison. You know, you've been in Miami longer now than you were here, and yet we sort of still feel like you're ours. And when you're here, it's an event.
Well, a piece of me is always here. I love Madison, I love the university, and I love Wisconsin. I was thinking the other day as I flew in that my favorite times in Wisconsin were with a guy named Arlie Mux, who was head of the Wisconsin Alumni Association. He just stepped down, but he was a pilot. So he would go along with the pilot and I when we went to visit alumni clubs. And, you know, the cranberry bogs, the dairy farmers. I mean, there was nothing that was more fun than early evening flying over Wisconsin and going to visit people in small towns and on their farms and trying to understand their commitment to education.
Does it still feel like home for you?
It still does. I'm a Midwesterner anyhow.
What are your fondest memories of your time here?
I think the students and being part of a great university. I also, people laugh when I say this, I love the state legislature. Because I taught state politics before I came here, I liked mixing it up with the Republicans and the Democrats. They were good friends by the time I left. So I enjoyed working with the legislature and with the governor. I worked with Tommy Thompson for many years because we got a lot of things done. They were goal-oriented. At least when I was here, they were goal-oriented. We never had enough money. But meeting these kids that came from all over Wisconsin, from little towns and from our bigger communities, and seeing at the end of 4 years what an impact we had on them, that was special. And of course, a world-class faculty. But, you know, who could beat Camp Randall on a Saturday afternoon?
And you're responsible for sort of revitalizing the football program.
Actually, a friend of mine was in a bar in I think in Bayfield not long ago, and he said he mentioned my name and everybody bought him drinks.
That's great.
He said, I didn't know you had anything to do with the football program.
Well, and now nursing is your mission.
Yes.
It's like you can take the girl out of HHS, but you can't take HHS out of the girl.
Absolutely.
So what brought you here?
I've just led an Institute of Medicine study of the future of nursing. The Institute of Medicine is one of the institutes of the National Academy of Sciences, so this is a big deal. These are the most prestigious scientists and physicians and nurses in the world that do studies on different subjects. They decided for the first time to take a look at nursing. They asked me to chair it. And basically the conclusion is that nursing, as expanded, better trained, is going to transform American healthcare, that they're the key to gluing everything together and making it work far more smoothly for 35 million people that are going to be coming into the system, plus people who have been in the system for a very long time.
How are they going to change things?
Well, I think that used correctly, chronic care management, primary care, palliative care, nurse-managed clinics, they simply are ways in which we can smooth out the rough edges in the healthcare system and get it to move in a patient-centered way. Nursing has always been patient-centered. They're the largest part of the workforce, and an opportunity to improve the quality of their training and education, to expand their roles, is unmatched.
Well, and look at the nursing school here and the expansion that they're trying to have here. It still takes money, and it still takes those relationships.
And great leadership.
On both sides of the aisle. How is our school different from where you are now in Miami?
Well, you know, Madison's just bigger than everybody else, but they both have the same kind of goals. The difference is that most of the nurses they're training here will stay in Wisconsin. What they're going to do is going to be revolutionary. They're going to train doctors and nurses and pharmacists together. That will help to transform healthcare. And, you know, it's one reason that I did something I rarely do. I wrote a personal check for that campaign.
And you'll be in Camp Randall tomorrow?
I'll be in Camp Randall tomorrow.
Cheering on Bucky.
Cheering on
just like the old days.
Just like the old days. I wonder if he'll recognize me.
Yeah, I bet he does.
Great to see you again.
Welcome home, Donna. Thank you.
Thank you very much.
Donna says she'll be in the stands. She doesn't like the boxes.
Right. Well, and she hired Pat Richter, who hired Barry Alvarez, for those of you who don't know. So that's why she's responsible for all of this.
Good to see her again.